Imagine waking up every day feeling completely exhausted, like you had the weight of the world on your shoulders. Now add multiple health conditions to the mix, and the challenge of losing weight seems like an impossible mountain to climb. But what if there was a way to tackle this head on, safely and effectively? Today in this video, I'm going to go over real struggles of weight loss when you have complex medical health issues to deal with, and cover a step-by-step approach that could change everything. Hey, I'm Dr. Carter with Modern Body Clinic, and we are weight loss experts. In this video, we're going to really dive into a comment or actually it was a question they had in response to a video we had on Phentermine. And this person had really complicated medical history, and they're feeling exhausted. And so they asked a question about Phentermine and weight loss. And so I did respond, but I did definitely want to go deeper into it. And I figured that I would share this video. And really, if you're less complicated, it'll be easier. Without further ado, here is Dr. Carter.
It could be definitely difficult to lose weight when everything's working okay, but certainly it's more challenging when you have a bunch of other health problems that you're dealing with. I thought this would be a good one to highlight some specific points that we can do to help, not just this person, but a lot of people. This is a comment. She's 57 years old. She has multiple medical problems. The highlighted ones would be the sleep apnea. She has hypothyroidism, and she had something called ischemic colitis. She also has an issue with fatigue and feeling tired, especially waking up. I don't know if you had that problem before, but nothing worse than waking up and feeling exhausted and you still got to go to work. And she's also 5'3", 279 pounds, so at least 100 pounds of excess body weight to address. That's what we're dealing with. The question was around Phentermine. Let's just answer that first. She has OSA, which is obstructive sleep apnea. Now, you can use it in sleep apnea. You have to be a little bit careful, but certainly you can use Phentermine in this setting, and weight loss will help improve the sleep apnea. But also sleep apnea can cause fatigue as well, something we want to address eventually. Ischemic colitis is when part of the colon is not getting enough blood flow, and in fact, it could be serious and life-threatening. And Phentermine is a stimulant to cause blood vessels to clamp down often, and that could mimic the effect, especially in the colon, of not getting enough blood flow. That would be enough for me to not utilize it in someone like this. Also, blood pressure being elevated or hypertension. If it's not controlled, I would not use Phentermine in this setting. And then also just any cardiovascular conditions, you probably want to avoid Phentermine. A no-go on Phentermine for this person. What would I do first? First, the diet 100% is important, particularly for this person. The fiber is going to be a big deal. She has IBS, she has diverticulosis, and she's had this history of ischemic colitis. This is someone I definitely want to make sure to get enough fiber. You want to have the colon act as normal as possible. Also, is going to help with the weight loss, and then also adding some healthy fats and proteins will be beneficial. That's where I would actually start. Now, the other big deal is going to be moving. Definitely a challenge if you're someone who has issues with fatigue and feeling exhausted when you wake up. However, getting some type of movement is going to actually help, hard as it may be. In the morning, it could be something very simple as you could just walk in place for 1 minute and then that's it. We want to get some movement early in the day that will actually help your energy levels. Certainly a balanced breakfast is going to help. That will include something with complex carbs, some protein and fat would be ideal. And then gentle movement. It could be as simple as a short walk, even around the block is enough to get started. One, just get in the habit, or just gentle stretching. That could be your exercise, but the takeaway is definitely get moving. That is actually going to help things. After that, if it were me, I would certainly want to make sure everything is maximized, everything is in order. Besides routine labs, for someone who has hyperthyroidism and they're complaining of symptoms that go with hyperthyroidism, I definitely want to dive deep into the thyroid functions. Often they would get a TSH, and that may be normal, and you're still having symptoms. You definitely want to look a little deeper. Sometimes people will not convert thyroid medication like they should. Often we use levothyroxine, which is T4. And when we use T4, your body has to convert it into the active hormone T3. And it doesn't always do that effectively. Not common, but some people will have that problem where they cannot convert it. They will convert it into what's called reverse T3, and the active thyroid hormone is T3. What can happen is your brain can't tell the difference. If you have a high reverse T3, your brain thinks everything's fine, but the reverse T3 doesn't do anything in the body. It doesn't do the same thing as T3 or the thyroid hormone. We'll see a normal TSH, but your body is not getting the thyroid hormone. You want to make sure it's correct, and so if it's not, then we can fix that. Next thing for this person, definitely the sleep apnea. That's low-hanging fruit. Generally, the treatment would be something called positive airway pressure. And when people have sleep apnea, they have issues with waking up at night, and it could be dozens of times per hour that they wake up. And you can imagine it'd be very difficult to get meaningful, restful sleep. If you're having awakenings 20, 40, 60 times an hour, it's just going to be very difficult to get deep sleep. The other consideration for someone like this is to speak with a GI specialist, given that she has the ischemic colitis, she has the diverticulosis, and she has what's called IBS, or irritable bowel syndrome. They can help maximize that the colon is working effectively. We've done all that. We make sure that we have some lifestyle things addressed, particularly the sleep, that we have some lifestyle issues addressed, particularly diet, some movement. We don't have to have this full-on workout activity, just start moving a little bit more. And we've done some laboratory assessment to make sure that the two big things that could be causing this fatigue and actually contribute to the weight gain or difficult weight loss would be the thyroid and the sleep apnea. After that, let's look at some medications. GLP-1s work for a lot of people, but not for everyone. Semaglutide or Wegovy is going to have meaningful weight loss for about 70% of people. Zepbound or tirzepatide, it's about 85%, and that's over an extended period. For in the shorter term, it's going to be even a lower number. Now, there's other medications as well. In our clinic, we will screen people to see which medication is going to work the best, and it's not always a GLP-1. Other medications that can be considered is Contrave, and particularly for people who have thyroid issues, I like this one as well because it does have an anti-inflammatory effect as well as the GLP-1s. This one can work well, particularly if you have craving issues as well. Metformin you can use off-label. Now, this weight loss effect is not super strong, but it can help. And for this person who I suspect they have some insulin resistance, metformin will help with that as well. Another medication that could be appropriate for someone like this is orlistat. Basically what this does is blocks fat absorption. So you have to be a little bit careful on fat-soluble vitamins, but otherwise this can help as well, and it's actually available over the counter. Once we've done that, now that we picked a medication and we have a meal plan and we're doing some activity, we want to essentially monitor how we're doing. So we create a plan, but obviously the plan is we have to adjust the plan based on how things are going, including tracking our weight. You also, for this person, I would recommend tracking energy. One way you can do that is just assess how you feel when you wake up. On a scale of 1 to 10, how much energy do you have? After dinner, same thing, how much energy do you have? And then you just track that over time. The other thing we're going to do is adjust diet or exercise, as well as the medications. The medications I mentioned, except for orlistat, they will be adjusted over time. Even the Phentermine would be adjusted over time based on how the person is responding to it in regards to weight loss and then side effects. Just to kind of summarize, we're going to look at where we're at right now, including assessing our labs and overall fitness, where we're at diet-wise as well. I think the big deal is just starting small. It can be overwhelming that we're just going to have this giant life change in 1 month. That's too much. In fact, it's mission impossible, not going to happen. Start small. Again, just like 1 minute of walking in place or walk around the block. Those can be very small. Don't take much time. We just really want to get into the habit. And then something else that's often overlooked is just making sure you have support system, having family, community, friends, whoever to help you on this journey. Ideally, it would be someone who's been where you're headed. They've been through this and they can guide you through the pitfall and again give you support when you hit a roadblock. Just remind you to start small with the exercise. Just make small diet changes at the beginning and definitely get support. So it could be even one person. This can really be meaningful.
Well, there you have it. I hope you found that helpful. If you have, please subscribe. It really does help the channel. And if you want to hang around a little bit longer and learn some other weight loss tips and tricks, check out one of these videos on weight loss.